Go through recommendations for the state hospitals, Larned, Osawatomie, Parsons, South Central, and K&I. I will back up a little bit and just give the committee an appreciation for what's going on in appropriations. Had Office of Veteran Services, excuse me, this morning in appropriations. We have 4 more tomorrow. I can't even remember which ones they are. I'll work on those tonight, and then another one Wednesday. So we're blowing through this committee work into appropriations rather quickly. So what I would say is bear with us. I know this is going to be a long week. Friday, I believe Francie is trying to, may have already done it, try to move the 3:30 to 1:30. Okay. So you will get out of here earlier Friday, but it's probably still going to be a long committee meeting on that day. So with that, I guess first thing I will do is see if there's any bill introductions. Seeing none. Okay, I want to move into recommendations for the state hospitals. And Sade, is there any kind of overarching thing you want to put out on this? What might be helpful is to go over again the special budget committee's actions that were taken. I mean, I can do that, but if you would save my voice from that, I'd appreciate it. You want to start with Larned? Whatever you want to start with is fine.
On Larned State Hospital, Sade King, Legislative Research. On Larned State Hospital, the Special Committee on the State Budget removed the SGF reappropriation in the amount of $14,754 and removed the 2 supplemental requests in fiscal year 2026 for agency nursing staff and the State Security Program Competency Unit. And for fiscal year 2027, remove those 2 enhancement requests.
Okay, thanks, Sade. Before I entertain any recommendations, what I would say back to the committee, when we had the hearing on this, we talked about they were negotiating new contracts with current nursing, contract nursing, pardon me, recruiting state employees for more nurses. There were positive trends in net hiring, and vacancies are under 30%. So that was kind of the story as we heard it a week ago. So I guess at this point I would entertain any motions. Representative Carpenter.
Thank you, Mr. Chairman. I would recommend that we, for both years, that we put back in the $32 million worth of contract nursing money.
You have a motion, I have a second? I have 3 seconds, but I'll go with Representative Oropeza.
Thank you, Mr. Chair. I'll second.
Okay, so we have a second. Any discussion? How about a little pontification? I know this is a problem that is not going away, and it is one that we will continue to remain focused on, but I don't know that just deleting it is going to get us anywhere. So I don't know if there's any other points of view or opinions on this. Anyway, that's the last pontification. Representative Carpenter.
So, Mr. Chairman, as you well know, you were on the committee. We did an interim committee for this. A lot of us walked away some kind of with more questions than answers on how to solve this. And we realized very quickly that there's not just one thing that is going to get us out of this deal with contract labor. It's attracting nurses. You know, I mean, there's just a myriad of things that affect the contract nursing location, all that kind of stuff. Doesn't mean we're not working on it, and I know the agency is working on it big time, and I appreciate their work, but it's just not going to be solved that quickly. So the alternative of not paying that, quite frankly, is close Larned Hospital, which we all know we're not going to do. So we might as well just bite the big one and put it back in there, and because it's going to go in there one way or the other.
Okay, Representative Rivas.
That's a question and a comment. My question is, what is the cost of nursing if we were paying state nurses for those positions versus contract? Instead of 32 million, what would that be, Will?
We've run the math on that. I don't remember.
Scott, do you have that for us? This was one of the things I think that is critical, and you sent it out to me, Scott, and I've got it somewhere.
Yeah, I
but
think that's the information point.
It's,
Fund us, at least fund us at the level we would have paid state nurses.
it seems like, well, what the difference is, what I asked him to put together was the difference between if we were fully staffed at Larned with state employees versus paying the contract. And was it 17 million, 27 million? What was the difference on that? One was 51 million and the other one was,
Scott? He's looking at you. You did something wrong. Scott Brenner, Deputy Secretary with KDADS. So if we filled, I think the question, because I was searching through what I brought, if we filled all of our vacant positions at Larned, that's $31 million, and at Osawatomie, it's about 16. That's at the current pay rates, or the average pay rate for RNs, LPNs, licensed mental health techs, and our MHCD, our direct care staff.
and what is the budget for the line item with the contract nursing at this point in time? The entire,
So for Larned, in 25, what we spent in 25 was a total of 57 million for our staff and the agency staff.
okay, so what is that, 27 million, 26 million is what we're paying?
26 or so is the.
26 million is what we're paying in extra for the contract nursing there, which is not chicken feed by any means, but at this point in time, there's not really an alternative.
And I think the other decision, Scott, excuse me, is that those 163 positions, FTE positions, were deleted as part of the budget. Is that correct?
That's correct. Yes, sir.
So that is different. So, okay. Thank you, Scott.
We do have the authority to create positions or use those positions, but given the budget action that would sweep any unspent salary money in fiscal 26, it was prudent for us to kind of right size the count so that we weren't showing that large savings that we're using for contract labor, but just so we wanted to put the salary money in the right place and show it as accurately as possible. But to do that, we had to eliminate that number of positions.
Thank you, Scott. Appreciate it. Okay, so I have a motion and a second. Any further discussion? Okay, all those in favor say aye. Aye. Opposed? Motion passes. I would entertain any other, again, still looking at Larned. One of the other budget actions was taken was a deletion of 1.1 million for the state security program, and then 14.74 million for reappropriated operating funds for the sexual predator treatment program. So let's talk about, say again? Yeah, that is a difference, isn't it? A little bit between 14 million and 14,000. Okay, let's stick with the state security program first. There was a deletion of 1.1 million for the state security program competency unit in FY26. Any thoughts or discussion? President Ballard?
I'm not really sure exactly when you said for the security reason, exactly what did that all entail?
So the state security program it provides mental health services to individuals referred to the hospital by district courts who have often had a longer stay due to circumstances surrounding their admission. And the other part of it is, I'm reading from their budget summary on page 1, which is the definition of the state security program.
Oh, okay, I see what you mean. I was looking right at it. Referred to by district courts often have a longer stay. All right. I think there's a concern there because number one, it's not really voluntary anymore unless we reach that census that we have. And if they have to, who often have a longer stay due to circumstances surrounding their admissions, If we don't do that, where do these individuals go?
Scott, you want to come back up? If that 1.1 million disappeared, or rephrase that, so how will we use that 1.1 million? What will it be used for specifically?
What we requested in the budget was to reopen a 20-bed unit in the state security program that's been closed because of staffing, or not having enough staffing. So with that enhancement, which we included in the budget process, was not included in the governor's budget, we'd reopen that 20-bed unit, staffing it probably with contractors, because if we had the staff, we would, anyway, you know that we've already been through that problem. So anyway, it would open that 20-bed unit, and we'd take 20 criminal defendants off the wait list that are currently waiting in county jails.
Okay, thanks, Scott. So as I look at the governor's budget recommendation, she did not include that.
May I?
President Ballard?
Didn't include that, but one of the things we heard is how long can, I mean, there's a long wait period that people stay in jail waiting and waiting and waiting. Now, is that fair to them because there's no place for them to be moved and get treatment, but they just stay in jail, not receiving any treatment unless they take them out temporarily to work with them? So, you know, I'm trying to save part of the budget too, but on the other hand, staying in jail where sometimes they're there 100 days, 200 days, longer than that, we're paying one way or the other, but somebody is paying for it.
Somebody is paying, right. Okay, so Representative Carpenter?
Thank you, Mr. Chairman. So if we could call Scott up here again. Scott, what's the balance on that fund that we have that we're paying the counties to house those folks? Do you know off the top of your head? Isn't it $5 million annually? And
So we have a $5 million appropriation to reimburse primarily hospitals for time that they are observing patients that are waiting for admission to a state hospital.
no, I'm talking about the county.
Yep, for the competency one, that's a demand transfer. So whatever reimbursement requests we receive from counties, we process, we validate it, and then I make a request to the Director of Accounts and Reports to transfer money directly from the general fund to our KDAD's fund so we can pay those invoices. So there's no balance because I make the request directly to the general fund and get whatever I don't mean to personalize it, get whatever we request based on the reimbursement request we receive. So there's no balance.
How is the $5 million fund, would any of these folks qualify for that?
No.
Okay.
You have to be in the criminal process in the forensic treatment path for this unit.
Very good, thank you.
Representative Ballard?
We pay $100 a day, and we pay transportation costs. Last fiscal year, we spent in the vicinity of $8 million. 7.8, I believe, was the exact amount, or close to the exact amount.
Apologies, no, it is. We're spending money, but we're not getting what we really need. I know there's a discrepancy in the money, but I only ask that question so that we understand that we may not can fund it, but it seems to me it would be a better use of our money.
Representative Carpenter?
Thank you, Mr. Chairman. So Following up on that line of thinking, would it be accurate to say that we would be saving 20 beds times 100 times a year if we housed them and we opened that up, for not paying the counties? Would that be accurate?
There, we wouldn't spend as much for the counties that request reimbursement for those 20. I imagine our throughput in terms of admission and cycling, we'd probably turn those beds over 10 times, so we'd serve 200, we'd take 200 total people off the wait list in a year. I don't know how many we're actually, we pay by the day, so I'd have to look at how many individuals that represents, but we wouldn't spend, there wouldn't be as much for counties to send us for reimbursement, so there would be some savings there.
That's what I was kind of getting to. Would there be offsetting savings for that $1.1 million out of the $8 million that we're reimbursing the counties?
Something I don't know. I'd have to go back and think about how to calculate it, because we'd also, there'd be other people in jail or additional people in jail that the people that we're serving at Larned are those that are more severe, that need competency restoration. So those people are waiting in jail to get to Larned. We'd take those off the list, but they'd probably be replaced with people who are waiting for other charges. But there'd be some offset, but I don't know how to calculate that.
Thank you, Scott. Representative Rivas?
Yeah, through the chair, Scott, quick question. Not to get in the weeds, but just curious, you mentioned 20 beds. Is there another operational number that would function, like if it was a 12 bed? Or is there a magic number that could function, maybe a little smaller, be a little bit less on the budget, but still get the job done?
The unit, that unit will hold 20, it has 20 sleeping rooms in it. So we could probably double occupancy, some of it go over 20, but I don't think there's a way to segregate 3 or 4 beds. We could just not use some rooms. I mean, if we didn't have the full appropriation, we'd serve fewer people.
Well, so the staff, have the
Right.
operators, a certain magic number, I'm sure, I just know what that is, so.
I think 20 is the number based on the way it's configured in the current staffing model. We could serve fewer people and reduce that. It would probably be in the half, so it'd probably be 10 would be the next, in terms of the staffing and the team rotation. Serving less than 10 is probably not efficient. Serving 12 is probably risky given the number of staff. So I think it'd probably be around 10.
The vice has a possible placeholder.
So I'd like to make a recommendation to hold that place on there for that 1.1 million, waiting for more information about what the offsetting savings would be from the $100 a day that we're paying now.
So I've got that motion. I have a second. Representative Ballard, discussion. Representative Reese?
Yes, I just need some clarification. On the budget summary that we received for 2027, we're talking about that, right? For 2027. Number 2, okay, because number 2 for the competency unit, it says 4.6 million of SGF to reopen the competency unit for 30 beds.
Scott? That's not for 2026.
No, it's 2027.
That's my mistake. Thanks, Sade. So our secure unit is 20 beds. This is the 30-bed unit. The configuration, it's two 30-bed units, so it's total 60. I apologize for that. I led you down the wrong path.
Okay, so I have a motion and a second. Any other further discussion? All those in favor say aye. Opposed? Motion passes. Okay, I'm going to try to do a better job of facilitating a little faster since we're eating up time here. We'll get better, folks. Okay, so the last thing we have is 14, there was a deletion of 14,754 for reappropriated funds in the Sexual Predator Treatment Program. That's not a whole lot of money. Hearing nothing. Okay, so no motion there. So let's move on to, first, I have a motion to approve fiscal year 26 as amended.
I'd make a motion to approve the 2026 Larned budget as amended.
Have a second? Representative Reese, seconds. All those in favor? Opposed? Okay, so 2026 is done. Let's go to 2027. And Sharday, maybe if you would, just if you can hit the governor's budget recommendation differences and the special budget committee. So I don't think everybody has those with them, do you? Everybody have those documents? And the governor's budget recommendation? Yellow sheet. Okay, we're gonna trust Sharday here.
Mr. Chair, for fiscal year 2027, for Larned, the major changes are the contract nursing again for fiscal year 2027 in the amount of 32.2 million. And for item number 2, the SSP competency unit for the full year would be 4.6 million. SGF was in the request, and that is not included in House Bill 2434. The governor's recommendation includes the contract nursing only.
Okay, so you've heard the differences. Do I have any motions or discussion? Representative Reese?
Going back to the competency unit, it would really help if this committee knew what other efforts are being done in other areas to decrease the amount of people that need these competency evaluations. I think there's some changes that might come about in the judiciary that could help with these court orders that maybe not in 27, but maybe in 28, 29, it might make a difference. Where we can, maybe there'll be less number of people that will have to go to a unit, and more of these orders could be done in the community.
Additional discussion? Representative Carpenter.
Thank you, Mr. Chairman. I would make a recommendation that we restore the contract labor money, the $32 million for 2027 for Larned State Hospital.
I have a motion. Do I have a second? Representative King? I have a motion and a second. Any discussion? Okay. All those in favor say aye. Opposed? Okay. Motion passes. Do you have any additional motions? Motion to approve the FY 2027 budget as amended.
I'd make a motion we approve the FY 2027 Larned State Hospital budget as amended.
I have a second from Representative Ballard. Any discussion? All those in favor say aye. Motion passes. Okay, Larned is done. All right, let's move on to Osawatomie next. Sharday.
Mr. Chair, for fiscal year 2026, the main difference is the agency nursing staff in the amount of 7 million SGF, and this item is included in the governor's recommendation. For FY 2027, it's 5 million SGF. And that's in the governor's recommendation. The agency's request included 3 therapist positions in the amount of 207,000 as well.
All right, let's keep it simple and let's start with FY 2026. Do I have any motion? Representative Carpenter.
Thank you, Mr. Chair. I would make a motion to restore the $7 million for the 2026 Osawatomie State Hospital contract nursing.
Representative Steen seconds. Any discussion? All those in favor say aye. Opposed? 2026 passes. Okay, let's now look at 2027. The two elements that Charday laid out were the contract nursing and the 3 FTEs. Have any motions or recommendations? Discussion? Representative Carpenter?
It's $5 million. I would recommend that we restore the $5 million contract nursing to Osawatomie State Hospital for 2027.
A motion, do I have a second? Representative Oropesa seconds. Any further discussion? All those in favor say aye. Motion passes. All right. Now let's take a look at 2027 again real quickly. Any further discussion? Do I have a motion on 2027? Looks like the vice is back up.
Thank you, Mr. Chair. I'd make a motion, we approve the budget for Osawatomie State Hospital as amended
For FY 2026.
for 2027.
Okay. Any discussion? Jill's looking confused. 26 and 27. Have a motion. Do I have a second? Representative Oropesa. Any further discussion? All those in favor say aye. Aye. Opposed? All right, we're through Osawatomie. Let's move on to Parsons. Charday to give us the quick brief.
Mr. Chair, the agency is requesting 43.9 million, including 25 million SGF and 505.2 FTE. The agency's reappropriations of 39,720 SGF was deleted in House Bill 2434.
Looking to see if there were any differences from the governor's budget recommendation.
Just that reappropriation.
Okay. All right. Kind of the budget status, do any discussion or any recommendations? Do I have a motion to approve the 2026 budget? It would be as, it would be with the deletion of the 39,000 SDF. Okay. Representative Ballard?
I had to find my notes. What I have here as a question is, okay, so this is a reappropriate, the unspent sexual predator treatment. I know we're looking at that program in terms of how effective it is, but I could not find where did we reappropriate this money from? Was it from a specific program that we were offering in there, or was it just money in general operational expenses? I couldn't find out what that was.
Park, I can tell it was just unspent funding that the Global Motion swept those up, reappropriated the unspent funds.
So, Mr. Chairman, we're making the assumption that it was unspent, it wasn't needed.
We could assume that. I don't know. It was just unspent. I would just go from there.
All right, without further information, I can't defend it.
So do I have a motion for FY 2026? Give it a shot, Representative Wolcott.
Sure. Thank you, Mr. Chair. I'd like to make a motion that we accept the budget recommendations for fiscal year 2026 for Parsons State Hospital.
Do I have a second? Representative Oropesa, seconds. Any discussion? All those in favor say aye. Aye. Opposed? All right, motion passes. Okay, let's take a quick look at 2027. Charday, any?
Mr. Chair, there are no adjustments from anything from the agency's revised request for fiscal year 2027.
Should be an easy one. Representative Steens, would you like to do this one?
Sure.
Thank you, Mr. Chair. I move to approve the budget for Parsons Hospital for fiscal year 2027. Aye.
South Central is the next one. Shouldn't be a lot of discussion on this one since we are just starting up. Sade, you want to talk about the deletion?
Mr. Chair, the agency's request is for 45.9 million, including 43.9 million SGF and 400.5 FTE positions. The global motion to remove all enhancement requests removed the 30.9 million, including 28.9 million SGF, and 336 FTE positions enhancement request. And that is the difference from the governor's recommendation as well.
Okay, so the governor added the 30.9 million and including 28.9 million, okay. Any discussion? Representative Carpenter?
Well, it just seems to me like if we're going to build a new hospital, we probably ought to fund it. Pretty simple. So I'd make a motion to restore that funding to open the hospital
Okay.
and whatever amounts that are pulled out of there.
A motion and a second. Do I have any discussion? Representative King?
Yes, thank you, Mr. Chair. I think we asked the question if this was going to be a dollar for dollar, just transfer from one agency to the other agency, and I'm not sure. I didn't see that answer, and maybe I missed it. So my question was, is this a dollar for dollar transfer?
I think Scott might be prepared to answer that question.
If I'm following the question, so we're transferring 15 million that's been appropriated to KDADS. That's going to happen on July 1, 2026 for the new fiscal year. This money would be appropriated directly to the South Central Regional Hospital and go into their account, its accounts directly. So 15 million is transferring from KDADS, but this is new funding.
Representative King?
Yes. So this was accounted for in our outlook budgets, our 2027, 28, 29, because this is new money.
It was included in the budget, correct?
It is included in the governor's budget recommendation, yes.
Representative Carpenter?
But the 15 million has been allocated, what, 2 or 3 years since the beginning of it.
23.
So that's just going to come into the account. There wasn't an account yet for South Central, so that money's just been sitting there. We appropriated it. I don't remember when we first started the hospital. Yeah, we appropriated that 15 million.
23, Scott.
It's been just sitting there until we had an account to put it in. This allows that to happen.
We have been spending the money to build the hospital and employ people, but it's been in KDADS, not in this hospital's budget.
And I think as Sade pointed out, this was the impact of the global motion at the Special Budget Committee. So with all that discussion, do I have a motion or a recommendation? Representative King?
I move that we recommend the South Central Regional Mental Health Hospital budget as presented.
Second?
I'll second.
A motion and a second. Any discussion? Representative Carpenter?
As amended. That's what I was.
As amended. Was there amendment?
Well, it would be to restore the,
Oh, the amendment to restore the funding.
it looked like we've confused Jill. Are we tracking Jill? Yeah. Okay. All those in favor say aye. Aye. Opposed? Motion passes. Okay. So point of clarification, now do we need a motion to approve 26 and 27? Representative Rivas, would you like to do that one?
I would move that we approve the budget for fiscal year 27 for the South Central Regional Hospital.
Oh, there's no 26.
27, as amended, yeah.
Second.
Charday?
For fiscal year 2026, the agency's revised estimate is 44.1 million, including 19.8 million SGF and 464.8 FTE. The request includes one supplemental request for certified medication aid positions in the amount of 1.2 million SGF, and which was deleted, and this is not included in the governor's recommendation.
Okay, committee, just as a moment of recall for myself, I went back and looked at this same budget from a year ago, and I think the same question and action was taken by on the committee on these certified medication aid positions. However, I know the ranking has done some research on this, so Representative Oropesa.
Yes, thank you, Chair. And I would like to recommend that we put in that, back in that 1.2 million for our SGF for certified medication aid positions. In addition, it will take some stress off of our LPNs and RNs that are already in these positions and help them to balance that out. And it could, potentially, we'd be saving about $22,000 a year while using CMAs per CMA. And I'll send that to you via email.
Say that again, I'm sorry.
We would be saving the state approximately $22,000 per year per CMA that we hire. Ultimately, I know we're spending 1.2 million, but when we hire the CMAs, they are definitely at a lower cost salary-wise compared to an LPN or even an RN.
Okay, thank you. Any further discussion? Okay, so do I have a recommendation?
I would like to recommend that we put in the certified medication aid positions, the 1.2 million SGF, to fund those CMA positions for FYI 2026.
Second by Representative Ballard. Discussion? Hearing none. We had a motion and a second to restore the $1.2 million for the certified medication aids. All those in favor say aye.
Aye.
Opposed? Motion passes. Okay, so that passes. Now I'm looking for a recommendation for, are there any other recommendations for FY26? Let's move on to 2027. Charday.
Mr. Chair, the agency's request is 44.8 million, including 20.9 million SGF. The enhancement requests were the certified medication aid positions and the cooks positions again, and this was not included in the governor's recommendation.
And again, this was the same condition that a year ago. Neither the CMAs or the cooks were funded a year ago. Okay, so there's the overview from Charday. Any discussion?
Susan?
Representative Reese?
I think we seriously need to take a look at the cooks, at the situation with the cooks, because it is the CNAs that are currently serving as cooks, along with whatever other jobs that they already have. And because of the nature of the dietary needs of the people that live there, some people have, problems with chewing, with swallowing, and I just think that a person that is trained as a cook to actually do the meals, and I know that the request is for $893,739, and that is to hire 21, let me see. would hire one cook manager, one cook supervisor, and 19 cook seniors across the living unit. So there are different units. So each of the units would have their own cook, and of course, they also have other staff. The CNAs that are doing all of that now would be able to go back to what they've been trained for as a CNA.
Is that in the form of a motion or discussion? Or any further discussion? Any further discussion? Representative Steens?
Thank you, Mr. Chair. I think watching that video obviously was very impactful for some of us and some of these patients that they take care of. And I would have to agree that I've worked in settings with mostly seniors, but there are very specific ways, like you have pureed, mechanical soft, finger food. I mean, I know that sounds like simple to some people, but you'd be surprised how difficult sometimes those can be. And then there's nectar thick, honey thick, all sorts of different variables and liquids as well. And so as some of my colleagues mentioned earlier too, if you were to swallow some of those things, you could have aspiration. There's all sorts of ways that you have to position. All of these people also have to be fed in many cases. And so you do need extra people to do that. And if you're cooking and trying to feed people and watch people, I don't know, this is just my thought process. I'm not saying, that that's for every client, but when I think about a lot of the things that are entailed with that, I know cook is almost kind of an understatement to me. I don't even know if that's the correct term. I mean, these people have to be very specified in their diets. And so I think we need to be thinking about that when we're thinking about these people being cared for properly. Thank you.
Representative King?
Thank you, Mr. Chair. I cannot support the cooks aspect of it. I'm not disagreeing that there's a lot of extra thought and work that goes into it, but 20 new positions for this one task I'm struggling with. So I'm not going to be supportive of that, but I will be supportive of the CMAs. Thank you.
Further discussion? Representative Ballard?
Well, I've been to KNI, and I have watched. And that's why I asked the question last week about the different cottages and where they were. And sometimes when they bring the food to the table, they're sitting there literally feeding them. And they don't have, and then there are other people doing it. So it's not like the cook is preparing the food and dish it on the plate and people eat. That's not how it works. You may have to jump up because someone is choking over here, and you have to go up over here, and it just goes on. So that I'm with Representative Steen, and maybe that's not the right title to be using for it, because you see another image of a cook. It's the person who is qualified to fix that meal the way that particular person needs their meal to be fed. It's not just food. It's either the puree, or it's this, or it's that. And if you don't have anybody specified to do it, and then just you do it. If you have time, you fill in. I think that's where it gets lost. And I don't think that's effective for what those individuals need when they're severely disabled in such a way. So if it's the cook title we have to deal with, but in terms of what they have to do, you almost have to have a specialty in order to do it. So I will support it. I've been there, I've seen it, and I know it's needed, and they've never had it.
Okay, thank you. Representative Carpenter?
Thank you, Mr. Chairman. I can't support this either. That's 20 people. What have they been doing for the last year or so? It was in last year's budget also. So I'm not incompassionate about this kind of stuff, but I just know that we've got some budget constraints, and 20 people is a pretty big ask with all the finances going around, so I won't be supporting this either.
Representative Rivas?
Yeah, to the chair, I'm sensitive to what these needs are. It's challenging. But what I would challenge them to go back and maybe find a different model. We've got multiple facilities in this town already that have hospital-based services, dietary people in place, and there's catering services. I don't know if there's another model to deliver this, and less cost without adding so much staff. So I think maybe they could take a fresh look at that. And my other question would be, what's the obligation as far as accreditation or licensing or whatever? That we want to stay within the rules and we want to provide good care and diet, but I think there's more of a balance to strike here.
Okay. Representative Wolcott?
Thank you, Mr. Chair. On these new positions, are these services going to, since we're doing them today, and this may be a question that can be answered, so the services are offered today. If we're going to bring new staff on, are they going to offset with less staff of a different category? Is there an offset, or is this truly just an addition?
I don't believe there was any subtraction. I think it's truly an addition. Any other questions? Representative Ballard?
Would one be well, with less positions, since you're worried about 20, would 10 to get it started? Does that make any difference? Or those of you who have a problem with it are just, your concern is with new positions? But I'm thinking in terms of what have they been doing with it before? They have been trying to do like 2 or 3 things at the same time. You know, feed them, fix the food. This week you parade, you do this, you do the other. So they've never had anyone designated in that respect. So I'm just trying to think, what are fewer positions just to specialize in getting the help that, I think this is the help they need. They've been making do, but they've gotten to the point that they just can't make do.
Representative King?
Thank you, Mr. Chair. Representative, to answer that question, I'd be willing to have them come back next year, to have the agency come back next year and have a plan for fewer FTEs, but not to try to go from 21 to 10 now or to 5 now, but have them have a well thought out plan. And to Representative Rivas's ideas, maybe there's another way to look at it, but I would not be supportive of adding anything in the 2027 budget like they asked.
I appreciate your explanation.
Thank you, Chair.
Thank you, Mr. Chairman.
I've lost track on where we are. We approve the medication aid, so is there a motion on the table to, just still discussing? Okay. Heard a lot of discussion. Do I have any recommendations, or do I have a recommendation for the budget?
Mr. Chair.
Representative King.
I recommend for fiscal year 27 KNI that we add the CMAs at approximately 1.2 million for the budget consideration.
I have a motion. Do I have a second? Second by Representative Oropeza. Any further discussion? Seeing none, all those in favor say aye. Opposed? Motion carries. All right, that closes out our budget recommendations for the day. And I'm sorry. Representative Oropeza.
Thank you, Mr. Chair. I recommend that we pass out the KNI budget as amended for 2026 and 2027. As amended, yes.
I have a motion. Do I have a second? Representative Ballard, any further discussion? All those in favor say aye. Opposed? Motion carries. Okay, now we're done with recommendations for the state hospitals. All right, for those in the audience, thank you for your patience. We have with us, are we going to do okay, I'm going to give Amanda a chance to do an overview, and then Secretary Stanek and staff is here. Thank you. Amanda, go for it.
Amanda from Legislative Research. I'll let you take a minute to look on your S drive. I didn't print copies this time. We're going to go over the Department of Health and Environment's budget. I promise I'll go quick. I can. All right. Alrighty, so we're going to go over the health side of KDHE. So we're going to cover healthcare finance, which oversees the state Medicaid and CHIP program. And then we're also going to go over the Division of Public Health. They have 8 bureaus that work with the local public health departments and other entities on public health services and regulatory programs. Again, first page, you can see the agency's actuals back to 24, the agency's approved amount in 26, which includes about 19 million in reappropriations, and then the agency's request for 26 and 27. On the next page is that budget snapshot, which is going to cover everything we're going to talk about today. You guys have heard the story before, so all the next several pages, it's all interconnected data that leads into what the agency's revised estimate and then budget request is for 26 and 27. And since I know we're short on time, we're going to jump all the way, I think it's page 906. It's that fiscal 26 table. Or page 10 if you're on an older version, depending on the budget summary you're looking at. It's this one. So line 1 is showing you that the end of session last year with the final appropriations bill passed, KDHE Health was approved for just over $4 billion in all funds with about $985 million in SGF. Those earlier pages that I skipped over, you can see that about 90% of that is tied to state aid and other assistance, and then the vast majority of that chunk is tied to caseloads. If you think back to the Human Services caseload memo, about 82 to 84% of that number in the top line is going to be caseloads, which has already been taken care of. But moving on, so the session ended in early spring without much of an omnibus, and then the fiscal year didn't end until June 30th. So lines 2 and 3 are describing those reappropriations. Line 2 is showing you the full amount of money that was unspent by the agency in 25, and then by law had to reappropriate into 26. And then line 3 is showing you that those reappropriated dollars were subjected to the 1.5% operations lapse. And so those two numbers total that line, which we're calling the subtotal approved with reappropriations. Beneath that, you can see the agency's supplemental requests for the current year. There's 2. One, that first one, the DCAS storage charges, the agency's asking for an additional $1 million SGF to cover charges by OITS. My understanding is that OITS recently rebid that statewide cloud server hosting contract, and there were some costs that didn't surface until session had ended. That cloud-based data storage costs the agency 25 cents per gigabyte per month, and the agency has around 419,000 gigabytes of data currently. So the 26 request you see here is for 3/4 of the year, and then in 27 you'll see it again, it's for a full year. Number 5 is the supplemental request to assist the Office of Vital Statistics in their relocation. Part of the agency shuffling with docking includes Kansas Highway Patrol, I think, moving into the Curtis building. And so this request is to help with the moving costs as they're being asked, Office of Vital Statistics is being asked to relocate. This request does occur in the next fiscal year as well because they're trying to understand when they would be moving, and then also funding to maintain the ongoing rent that they're going to have an increase in. And then 6 through 9, just the other changes that are in the agency's request, primarily in special revenue and federal funds. Item 8 is just a transfer. There's no net change in the approved, but what you're seeing is that there was a transfer of $2 million from the general public health operating expenditure account to the women's wellness account as an aid to local. That's all I have for the current year, Chair. Is it all right if I move on to the next year and then I'll cover something else? Okay. So moving forward, let's jump to 27. That's going to begin on page 909 or 13, depending on what you're looking at. So same idea here. This is going to begin on July 1st. And at the top of the table, we're starting with the amount approved last session for the current fiscal year. And then we're removing out any one-time expenditures. And those are all listed in the bulleted list below. And then the next middle section covers all the enhancement requests. Number 2 in that is the funding I just described about OITS with the cloud storage. Number 3 in that list, the agency's requesting $1 million SGF to support the salaries of the 15 current staff members in the Disease Intervention Specialist Program. State law and regulation requires labs and health professionals to report infectious diseases, including STIs. And when those are reported to KDHE, it's these individuals here, these disease intervention specialists, who then interview infected individuals and then also try to locate sexual or needle partners to help ensure that they too get tested and treated and to help further prevent the spread of disease. And so that's that request. Number 4, the agency is anticipating increased costs as they renegotiate their EQRO contract, so External Quality Review Organization is what that stands for. CanCare is required to contract with an accredited external entity for quality control for the care provided by the MCOs. So currently, this is with KFMC here in town. And the state contract with them ends in June. And so this is the agency requesting $4 million all funds, including $1 million SGF for anticipated contract increases with that. Number 5 is funding for Gainwell. So Gainwell is the tech vendor that's behind the Kansas Modular Medicaid System, KMMS, which handles our state Medicaid program. Gainwell is the tech giant behind that. And so this funding would go to Gainwell, and it would help address CMS Final Rule 0056F, which is the adoption of updated national standards for electronic transactions of retail, pharmacy, and subrogation. It's a mouthful. My understanding is the final rule states it's to require states and pharmacies to use a newer standardized format, electronic format, when they talk to one another. And so this is the charge for Gainwell to kind of implement that new rule. Item 6, the agency is requesting additional funding for lab scientists at KHEL. Number 7 is back to that Office of Vital Statistics relocation I mentioned. Number 8 is another CMS final rule payment to Gainwell. For this one, it's interoperability and prior auth, and it requires Medicaid managed care plans to respond electronically on the prior auths. It also requires the Medicaid programs to share data securely through APIs and track and report some metrics around prior authorizations. And so to do all of this, the agency is requesting about 3.4 million SGF to complete those system changes. Item 9, the agency is requesting $17,000 to continue providing access, communities access to the care registry for 27. This is a registry that collects data on out-of-hospital cardiac arrests to improve survival rates. I think in the narrative text, I listed out the participating counties at this time, and so the requested funding would help maintain Kansas EMS agencies and hospitals' access to that registry. And then the last item is CHIP. The agency is asking $26 million. This is to address caseload increases, and then there was some CMS guidance that eliminates lockout periods with CHIP. And certainly that's a larger ask, and so I'm sure the agency can come up after me and describe that a little bit more. 11, 12, and 13, typical other changes that we'd expect to see, or we often see, I should say. And then the last few pages, okay, 2 things. The last few pages in the document are all about the Rural Health Transformation Program. That's the additional funding that's coming through from the federal government. Frankly, the last few pages are outdated at this point. The state did receive the first year of funding. I think it was $221 million in year 1. And so all of the stuff in the back is just about that program. But before I stand for questions, Chair, can I go over GovRec?
Please.
In light of all this? Okay. So I actually have a new document for the committee, if that's all right, Chair. So this was a document that was requested actually on the Senate side last week, and it is pretty helpful. I've been calling it a 3-column. So if you're looking like at the 26 side, you're going to see on the left side, you're seeing what the agency request was for all those items I just described. The middle is going to show what the special committee on state budget did, and then on the far right, you're seeing what the governor's rec is. And so it's kind of comparing all of those items. And if you flip to 27, let's look at 27 because that's kind of the big one. You can see that there's some of them are numbers differences. So for example, that first one, decast storage charge, the governor recommended that item, but at a significantly lower amount. And that of course can be for a variety of reasons. But on this list, the things that I want to point out are, all right. So one of the items is the adult inpatient behavioral health sciences. It's, I don't know, 2/4 down the list of the enhancement requests. So this is adding the $5 million for hospitals that hold open beds for the hold open inpatient behavioral health beds. And so in the governor's, it's been added for a couple years. In the governor's budget, she did go ahead and give $5 million. I think the year prior it was $10 million. And then there's some added language there too that talks about that this funding is meant to only be 1 year, and that should, once the South Central Hospital opens up, that this funding should not continue. The Kansas Office of Early Childhood Transition. So that's going to be the deletion. I think we talked about this in DCF as well. This is the KDHE portion of money that's going to get deleted as we have that new agency for Office of Early Childhood. The Infant and Toddlers Program one. That one, so there's a couple, I guess. So it's infant and toddlers. If you want to check, kind of put a dot by that one, it's going to be the SIDS network grant and then the smoking prevention grants. So those 3 items are cases where it's been determined that CIF is no longer the appropriate source of funding. And so in the governor's bill, she's either proposing state general fund, or I think one of them was from the Key Fund. Infant and toddlers, that's going to be an SGF swap. So we're cutting it from the Children's Initiative Fund and they're asking for state general funds. The SIDS one is the same idea. So they're adding money with state general fund dollars and deleting that amount from the Children's Initiative Fund. And then the smoking prevention grant, that's going to be funded directly from the Key Fund. And I think that's all the items for GovRec that I was going to cover. So I'm happy to stand for questions, Chair.
Any questions? Representative Wolcott?
Thank you, Mr. Chair. Just to kind of reiterate here, because I was trying to read and listen at the same time and I failed to. So Infant and Toddlers Program and the SIDS Network Grant, those are funded somewhere else today, and they're looking to pull them out of, where was that funds coming from?
Sure. So, Chair, originally, those items and the smoking prevention grants, those were funded with the Children Initiative Fund dollars, the CIF dollars. That's kind of a sub-account of the Key Fund, which is all the tobacco settlement money. And over the years, there are people that are probably going to testify tomorrow about this. Over the years, that money has been used for different purposes. And so now as we're looking at the out years, that is going to go negative if we continue the expenditures. And so last year there was something in DCF's budget, I can't remember what it was. This year you're seeing these 3 items that they're trying to say, we like these programs, we want these programs, we can't keep funding them with CIF. So if the legislature wants to keep funding them, we need to move it over to state general fund.
Committee, any other questions? Representative Rivas?
A little clarification. So smoking prevention grant, it's a 0. There's nothing on the budget there. So is this just a placeholder for when grant money comes in from somewhere?
No, the reason, Chair, you're seeing it as zeros there is because currently it's funded with the CIF money, and the change on the smoking prevention grants is that instead of coming out of that sub-account, that Children's Initiative Fund account, it's going to be funded directly from that parent account, the Key Fund. And so here on this table, it's no change in SGF because they're not looking for SGF on that one. The total is there's no change because it's already being currently funded. They're just asking that it goes directly from the Key Fund and not the Children's Initiative Fund.
Representative Carpenter?
Thank you, Mr. Chair. So if my eyes don't deceive me, the governor put in 15 million of the 26 million that was asked for CHIPS. Is that what I'm seeing?
Yes, sir.
Okay. And then, Mr. Chairman, may I ask?
Good.
So down here to other adjustments, and the agency has subtracted $29 million for, I see a variety of things on here, including 9 million federal funds and 20 million other. What would the other be?
Most likely just smaller special revenue funds that get tweaked as they have better revenue estimates and better balance estimates.
So just, I guess, you want 26 million, you give up 29. It just seems to me like you probably just trade.
Representative Ballard?
Maybe I can't find it either, but how much money do we have in the key fund?
Sure, Chair. I apologize. I should have brought our updated key and CIF documentation. I didn't bring it. It's something Jennifer Light in my office is the coordinator for that fund. She does a great presentation on it. And then, like I said, I know if it's anything like on the Senate side, you're going to have people coming in tomorrow that are going to talk a lot about it and explain the balances and where it's at.
Carpenter?
Yeah, Representative, it's about a $10 million deficit this year in the Keys Fund, or Children's Initiative Fund, whichever one you want to call it.
So does that mean that our tobacco money has gotten less and less and less and less and less? And we knew that by the time we were getting close to 2028 or something, we were going to be running out. So are we still receiving any money from the tobacco fund?
I think the balance was 40 million or something like that. It's
32 or something like
It
that.
keeps shrinking. It was 50 some, and now it just.
Thank you.
Okay, committee, any other questions? Okay, with that, Secretary Stanek, welcome to committee.
There, I'm on now. Hi, everyone. Secretary Janet Stanek, KDHE. You have a document in front of you. It's titled Budget Consideration Requests from KDHE. It's about 4 pages. Does everyone have that? I'd like to quickly start with reappropriations, if that's okay, on page 3.
Sure.
All right. You see a number of reappropriations highlighted there, and we're requesting your support on these things. I'm going to jump around a little bit and jump, first of all, the special enhanced FMAP for $11,786,000. That's important related to the fact that, excuse me, that is something that was part of the, I apologize, the ARPA grant. It's an ARPA fund that we will spend down. It's due to be spent down by the end of '27, and it's in process and being spent. So we'd like to continue doing that. Then there's the Public Health Early Childhood Data Management System. The reason this has not been spent is because it's a little longer to get up and running, and we are midway through or start partially implemented, and to stop now would be like a partially implemented system that would serve of no value. The third one is the breast cancer screening program. This is a product of timing. It's also a product of early detection work. We tend to use federal funds first so that we can have some reserve, because we would avoid a waiting list should we not have any money to address those that are in need. And the number of patients that we have varies from year to year, and therefore we're asking you for continued support there. There's also the Child Abuse Review and Evaluation Program, the CARE program. For the money there, we've had less kids be seen, and this is a matter of training more people that, the physicians that is, not people, that utilize and have to complete the training. This lets us invest in this more, and we didn't need as much money for the actual system itself. There's also an initiative related to what's known as the PKU, phenylketonuria treatment. That is a treatment for, and also a product of the number of children that get diagnosed with PKU. This is a disabling and very serious disease. And we would like to continue to be able to support those programs. Those funds are very restricted to medications and nutritional products, for example, that those children need. There's also the tobacco cessation program, something that you've heard about. This is a very important public health program. We'd like to be able to continue to use that. For the money that, we've redirected some of that money that got restricted by the federal government, but we're able to continue, obviously, to support tobacco cessation initiatives. Let's see, go. I think I talked about CHIP. If I haven't, CHIP is up there as well. There's a small amount for CHIP. You'll see there's more of that in our enhancement requests for 27. This is simply to continue to treat those patients that are in the CHIP program. Let's see, Pregnancy Maintenance Initiative, that's one that you're all familiar with here. We continue to make sure that our pregnant mothers are able to continue to get care all the way through their pregnancy in a safe and effective manner. Aid to local units, that is simply money that goes out the door for our partners. And then the state trauma fund money that's highlighted had already been expended. So that's just a matter of being able to budget and carry that forward. The rest we're leaving as miscellaneous items at the bottom. So I'll stop there with our reappropriations and ask if there's any questions, unless you want me to jump to enhancements. And I have my team here too as well. Thank you.
A couple of questions. Representative Wolcott?
Thank you, Mr. Chair. Are some of these funds already spent that
Yeah.
we're looking to reappropriate?
Yes. They're like midway through.
Is that the difference between the bold ones and the non-bold ones on the list? Is the bold ones have already been spent and the non or not? Or what's the difference in the color coordination?
The ones at the bottom basically are things that we feel like we'll try to cover in a different manner, just to support giving up something. So the ones on the top absolutely are in process, yes. You'd be stopping a program like in the middle of the stream, you know?
Representative Wolcott, follow up?
Yeah, thank you, Mr. Chair.
Okay.
So the ones in bold make that 19.2 million?
I don't think so. I think it's all of them, correct? Amanda, can you help me?
Yes, so no, the ones in bold total about 17 million and some change, but the entire table that she has totals the 19 million.
One more time, Representative Wolcott?
Sorry about that, Mr. Chair. So can you kind of clarify then, the non-bold ones you said you were going to fund a different way?
We'll try to continue them some other way.
So not in this, so we can remove that from the 19 million, or you're still requesting them?
We'd like to have it, but if you don't, I mean, we wanted to do it in priority order based on some discussion we had with the chair. So we tried to prioritize what we really want to ask for. They're all important, but yeah.
Thank you.
Does that help? I hope so.
Yes, thank you. Representative Steens?
Thank you, Mr. Chair. Thank you for your presentation. Just a quick question on tobacco cessation program. Does that also, like, because I know vaping is really big and stuff right now. Do we do initiatives? Is that included in with that? Thank you.
As far as vaping goes? Yeah. One moment. Yes, we do. Yeah, I had to turn to my deputy secretary to make sure that that piece of it was covered. So yes. Mhm.
Okay, committee, any additional questions? Representative Carpenter?
Thank you, Mr. Chair. So just to be clear, this is the Pregnancy Maintenance Initiative. That's the Stan Clark Pregnancy Initiative.
Yes, it is. Uh-huh.
Very good.
Yes.
I'm taking a note on that. Okay.
Okay.
Any other questions? Okay, please continue, Janet.
Okay, I'm going to jump to enhancements, and those start on page 1. So I'll start with the big one, with this CHIP. You noted that earlier, 15 million. That is because basically more children were seen, and actually more people, they needed more services than predicted. So we are asking for the 15 million. Just to give you an idea, that's an $86 million SGF normal total, with about 260 million all funds for the CHIP program. Number two is, I call some of these have-tos, that is the OITS storage. And that's 500,000 SGF that we're asking for to meet the OITS request for the data center. We have a ton of data, as you know, in KDHE. Another have-to is a Medicaid program. There's 1 million for the National Council for Prescription Drug Program. A lot of those modifications have to do with the system. We have to comply. CMS monitors us, and we're at risk for getting Medicaid money pulled from us if we do not comply. Just one of the many, just to note, CMS requirements for the Medicaid program. On page 2 at the top, you have already talked a little bit about the Office of Vital Statistics relocation. That is a have-to. We do have to move. Highway Patrol is going to move into our space. We expect that to occur sometime after July. And we are asking for $810,000, $817,000 for that move. There's another have-to. It's a Medicaid rule called the Interoperability Final Rule. It pertains to Medicaid data and prior authorization, and again involves systems changes to our information system and so forth. We would be subject to audits by CMS for noncompliance. There is $300,000 in SGF, also requested related to maternal health. This is a grant, the Maternal Anti-Violence Innovation Sharing, and we call it MAVIS grant. We're on year 5 of 5. It'll, I think, end in September of this year. This would, funding would support continued work, and this has to do with intimate partner violence. You'll hear that's a big public health issue right now. And it would provide, providers basically would be able to strengthen care coordination for these patients. And we would want to continue that program if we're able to. You talked a little bit about the $5 million in the behavioral health beds. In the previous 2 years, the legislature has put in money for, I think it's about 7 hospitals that are listed there who would get money based on the number of beds they have. So this is a continuation of that. And those are the enhancements that we are requesting. And I'll take any questions now and turn to my team if I can answer. Thank you.
Committee questions? Representative King?
Thank you, Mr. Chair. Thank you, Madam Secretary. I have a couple of questions here. I'll just go in order here.
Okay.
If that's okay.
Yeah.
Enhancements, the 15 million for the first one, the CHIP program. How many number of people, you said it'd be an increase in the number of people? How many are we talking about there? How many are we currently serving, and how many do we think that we would need to serve? So I guess the delta there.
I'm going to call on Deputy Secretary Osterlund to answer that, please.
Thank you.
Christine, welcome.
Christine Osterlund, Deputy Secretary of Agency Integration, the State Medicaid Director. So there's really 2 issues, well, really 3 items coming into this. So the first is, as we did our estimates for unwinding, we thought that we would end about 10,000 children lower than we did. And so our enrollment month over month is about 10,000 children higher than we anticipated when unwinding would end. On top of that, during the unwinding, CMS issued, well, there's some legislation passed, and then CMS issued a final rule that did 2 things. One, it prevented the state from disenrolling children for non-payment of premium. So what used to happen is if a parent did not pay the premium for their child, after 2 invoices unpaid, the child would be disenrolled and then would be subject to a lockout period for 60 days. So in the course of 12 months, you might only pay for 10 months of coverage, you might pay for less than that. We now have to pay for all 12 months, so we're paying, on top of having 10,000 more children, we're paying for more member months. So there's just some, and then there's another facet of the rule that also is impacting enrollment a little bit. But those are the 2 biggest factors for the increased cost.
Okay, Representative King?
So 10,000 more, so how many, what's the total number that you're serving? Is it 500,000? Is it 300,000?
Oh, no. CHIP is, yeah, I do. CHIP is much smaller. Let me look here real quick. I think it's around 50-some, though. Yeah, it's 57,000.
57,000, and we're adding about 10,000 at 15 million, so about 150,000 per kid.
Yep. Yeah, and then as the secretary alluded to, we've seen higher utilization trends, which we've also seen in Medicaid for our child population. So that's kind of the third factor that's been playing into the increased cost.
All right, then my second question, that was just one question, by the way.
Clever.
I mean, I only get one mark there. Thank you, Mr. Chair. The $810,000 relocation, where are you moving to that group, and about how many people are involved in that? How many FTEs would be involved in that?
80. I think about 80 FTEs are moving. And D of A, Department of Administration, is coordinating that move. We don't have an exact location yet. They're still narrowing. We were close, and we're not sure we're able to move in that location. But it will be somewhere that is public-facing, like, because people have to have the ability to get in and out easily and so forth. So we don't quite know yet.
And continuation on my second question, so Frank and D of A gives you the rate, and you just pay the rate at what it costs to relocate?
More or less.
Okay. And then my last question, I promise, Mr. Chair. The last one, the $5 million for patient behavioral health. The way I understand this is patients voluntarily opt into this behavioral health at these 7 or 6 hospitals?
I'm not aware that anybody has an involuntary program that's in these hospitals. So there are units, yes, where patients get transferred and or admitted to behavioral health services.
These are the voluntary, I believe.
Yes.
And
They're regular hospitals that have that service.
So my comment now would be is if we fund this and maybe even fund it more, can we get clients and citizens to voluntarily come into the system before they get overwhelmed, and we can provide help and support at a much earlier point rather than wait until they get to Larned or Osh or somewhere else. So anyway, just a comment there. Thank you, Mr. Chair. Thank you, Madam Secretary.
Thank you.
Representative Carpenter.
Thank you. And the representative, we do have plenty of things that try to stop them from getting to that level, but these are kind of, there's not much you can do about it. We're paying those. If we had a state hospital large enough, we could house these in ourselves, but what we found ourselves is we can't. So we're paying the hospitals for storing our folks, actually. My question is about the chips. You asked, didn't you ask for 26 million?
Yes.
First, I'm sorry.
Yes, originally, yes.
And so what's changed?
Basically, I believe the governor, it was just an adjustment that was done to the 15 million. And that's on that sheet, correct?
Do you need the 26 or do you need the 15?
Well, we asked for the 26. You know, we don't get everything. We know that resources have to be redirected. And so, like any other agency, we would try to figure out how we would deal with the deficit if it came up to that. So,
And how would that affect coverage for kids?
well, worst case scenario is probably couldn't have them on the program, but that's the extreme. We don't find ourselves usually doing that. Christine, do you have anything to add to my comment?
So, yes, if we run out of funding, the choice for the state would be to end the CHIP program. It is not an entitlement, so unlike the Title 19 or Medicaid, it's an allotment, and if we don't have enough state dollars to draw down the federal dollars, then the only option available to the state would be to end the program with appropriate notice requirements and other activities.
I get it. And I'm a big supporter of the CHIPS program, as you know.
Yeah.
It averages $200 a month for us in the Medicaid program 250% of poverty. It's a sliding scale of up to $50 for the families that, and I think it's like $85,000 or $90,000 that you can qualify for with 5 children.
Yeah.
Close to that.
Yeah, it's, yeah,
Don't hold me to that.
significantly higher than our Medicaid
But
thresholds.
great program. If these kids are our wards, we should make sure that their health is done. So thank you for that.
Yeah.
Representative Reese?
Regarding the 5 million in for the inpatient behavioral health, is this funding that is given to these hospitals where they can have people that are waiting to go to the state hospital, but they can stay in the beds there at the hospital, in the psychiatric units?
Once we give the hospitals that money, it's for their use for their behavioral health services that they're rendering. So probably theoretically, yes.
Thank you.
Representative Ballard?
Thank you, Mr. Chairman. I want to follow up on the CHIP again, the 26 to 15. How does that translate to number that you'll be able to enroll?
Do you have that off?
So this gets very challenging. That's why I went to our really choice for the state would be to end the program. There used to be provisions that states were allowed to cap enrollment for CHIP if you were going to run out of your allotment. With some of the recent legislation and CMS final rules, that is not an option to states anymore. So we don't have a lot of the levers that we used to have when it comes to CHIP as far as controlling costs. So it really is, we either have to have the state funds to draw down the federal match, or it gets drastic.
Is that 60/40?
It is 70, like 71% is CHIP. It's higher than our Medicaid population.
So if I'll just be bold and ask the question. So you get 15 million with 26. Roughly that puts you at about 60-some percent. It's around that area that we have with the funding. Now, if you close the program.
So we would, again, let's go catastrophic situation. Obviously, the 15 million would get us into several months into the next state fiscal year. We would have caseloads in November. We would have the start of session in January to come for an emergency request. So it's not like there's no other options for us in between now and but it does put risk, obviously definitely puts risk in the program.
Yeah. So does that mean, is there any other fund you can draw from until you get additional budget or?
Potentially the fee fund. I mean, yes, there are potentially other funds that we have, that we'd have to look at what the reserves are at that time. Again, 15 to 20, 26 million, that's like $11 million. But yes, there are other funds that potentially, and we could follow up more, like what those balances are, what the risk would be.
But if you have to close it, you're affecting roughly
57,000 children.
Thank you, Mr. Chairman.
Yep.
Any additional questions? I have one for Janet, just because every agency in appropriations has gotten blasted by the move question. So you're getting kicked to the curb by the Highway Patrol on behalf of the Department of Administration. Where are you moving to? You say the Landon Building?
We don't know where we're.
Oh.
No, that's what I answered earlier. We don't know where we're moving yet. There's a work being done by D of A. We're probably a little challenging because of the fact that we do need a location that's like the DMV, where people can come in and whatever. And so we hope to know soon. And in the meantime, we know per cost, normally what it would cost per employee and all they have to do. And then I don't know what the D of A, their work costs are to do all of that. But we could surely get Frank to help us out with that if you need a deep.
Time frame?
We just know it's after July.
After July, okay. New fiscal year, okay.
Yes, yes. Mm-hmm.
Thank you.
Yeah, I don't have more details, sorry.
Well, that's okay. I've seen every agency get hammered on why all the moves, et cetera, et cetera. Appreciate that. Okay. Additional questions? Okay.
Thanks for having us here today. Thank you.
Kind of stunned. I thought we would be here a lot longer. Okay, committee, I think that wraps us up for today. Francie, what do we have on the agenda for tomorrow? Okay, yeah, stands to reason. Testimony for KDHE tomorrow. Okay. I'm not going to ramble anymore. Committee, we are adjourned.